Hello and welcome to the podcast. My name is Kiriga. Today I'm with my friend and my colleague Stacy. I'm going to let her introduce herself so that we can hear from her.
Hello, and thank you for welcoming me to your podcast. My name is Stacy Odero. I'm Veronica's colleague. I'm a physiotherapist, pelvic health specialist, and also a lymphedema specialist.
Awesome. So Stacy, tell me, why are you doing pelvic health?
I'm doing pelvic health because I've seen this is a field that not so many people are in. There is a gap in the society and in the medical field. So you find that we have patients whom they go for gynecological consultations, but from there they don't know where to go to. And they end up staying at home because of stigma, because of the issues that they're suffering from. Maybe it's urinary leakage or stool leakage. And so as we come on board to help rehabilitate these patients back to normal. So I saw it like it's a gap that needs to be filled, and so that we can create awareness both in the medical field and also to the local mwananchi.
Awesome. Okay. So the main condition we're going to be discussing today is something called vaginismus. So tell me, how was your school experience with sex education? What did you guys learn?
If I remember well, I don't think we had like a very serious class about sex education.
Okay.
We were just taught about the way you were being taught about reproduction and how maybe reproduction takes place, adolescents, in girls and ladies.
That was in class 6, yeah?
Yeah, it was just like a normal science class, but we never really had the nitty-gritties of really what goes on where. That we had to find out for ourselves, maybe by reading novels or interacting with older students.
Oh, that's interesting. For us, I remember we used to be separated, boys and girls. So we'll have the usual class 6 coursework, which has their puberty and the adolescence bit. But then they used to separate us to have like a boys section and a girls section. And for girls, they used to, of course, tell us that boys are bad for you, can get pregnant, and now that because your menstruation has started, you can become a mother very easily, and they would make sex seem like taboo and a wrong thing. The only good thing I can remember from those classes was maybe they taught us how to put on sanitary towels. Yeah, but I don't remember anything else. So let's move from the introduction of sex education to now you've joined campus, yes? And I remember we had a unit called Ops Gain. So what can you say about the way the unit was taught and what you took away from it? Speaking as a woman and as a specialist now.
I think the unit, it was just, we didn't know that a physiotherapist can specialize in this field. So to us, we just saw it like any other unit, whereby it's just a lecturer teaching. And we never used to go into details. We just like introduction, like definition and overview of treatment. Yeah, so it wasn't really in depth, and actually I never knew I'd ever end up in this field.
You rotating in Ops Gain.
No, we didn't get that time because I remember COVID happened, so it disrupted the schedule for the rotation. So it never ended up going to all the rotation. But once I started working is when I was now exposed much into this field, and I was like, this is a nice field. I won't mind.
So did you go into it because it's nice or they're calling there?
Because I remember when I was working, we used to have patients all over the country. Some will travel all the way from Busia, others from even Somalia. They come and rent an Airbnb so that they can come for treatment. So like people really needed this treatment, but they didn't know where to get it. So I saw like there's a really big gap. And when we even used to have patients from Uganda all the way. And when they get healed, they were so happy. I could see how they were just very happy.
So for context, let me just explain. Stacy started working in pelvic health before she even trained in pelvic health itself as a specialist, which is the place where we met. Yeah, we met at a clinic that was specializing in pelvic health and lymphedema management, and this was a very good opportunity for both of us because we got to see the gaps that exist in our country and areas of specialities that we can actually get involved in and really, really help the population. So I'm so grateful right now that she has joined school. She's doing one of the AMREF programs, yes, which is sponsored by the Jackson Clinic.
Jackson Foundation Clinic.
Yes. So we have, how many specialists do we have in pelvic health right now?
And the ones that are fully certified.
Yes.
I think maybe they are less than 40.
Less than 40.
But not everyone is practicing. Those who are practicing, maybe they are like 20, 25.
Yeah, so you can imagine for our population, those are very few practitioners.
Yeah.
And also, I feel like people don't even know that physiotherapists can help in this area. So let me talk to you in general. Or how was your first encounter with a pelvic health patient? Did you feel confident talking to them? Do you feel like this, also given like our society, the taboos, and even our parents don't talk to us about sex, our pelvises, that would be a very weird conversation to be having. So how has been your posture when you're talking to these patients? Do you feel confident? Do you feel like we need more training? What is your approach? What do you?
I think maybe in general, we need more desensitization on this matter onto the public. Because you find when I talk to older patients, there's like a very big, how do I put it? There's a wall there. It's like you're explaining something that you're not supposed to talk about.
Yeah.
And so even how they receive it is a bit.
By older, what do you mean? Because how old are you? Anyway.
Because okay, I'm 25. Probably you're seeing a 50-year-old lady. So to them, they see you like their child or like their grandchild. So sometimes you're trying to ask them questions, leading questions about their private area, and they feel uncomfortable.
Yeah.
So mostly when I was working, my boss would introduce me to younger patients first, who are closer to my age, so that it's easy to talk about these things and it's easy for them to open up.
Yeah.
Because sometimes it's hard for older patients to open up about these things.
Yeah. And also, sometimes I found that sometimes when a patient comes to you, they might be presenting with other issues like back pain. And they don't know that what they actually have is a pelvic health dysfunction. Yeah. And so even approaching that topic, there's that barrier because there's no one was talking to you about their sex life. And then here you are now asking questions. And they're looking at you like, excuse me?
They feel like you're intruding into their privacy.
You're intruding. So especially for this topic, like vaginismus, you want to tell us what is vaginismus in your understanding?
I think vaginismus is the involuntary contraction or the tightening of vaginal muscles, particularly the muscles around the entrance of the vagina, and this makes the penetration difficult or painful or even impossible. And it's usually caused by, it can be psychological or maybe due to other diseases. And you find it can occur during sexual intercourse, can have this pain during insertion of tampons or even during the gynecological pelvic examinations. We find that it's very difficult to perform them.
So an example of gynecological examinations are pap smear. Yes. which is something that we recommend for everyone 30 should at least get up to know how your habit is. And yeah, that's a situation where you could be experiencing pain, especially when they explain to it. And it's not supposed to be a painful procedure, yeah. True. Yes, but sometimes you find because of maybe a condition like vaginismus, it's more than uncomfortable. Yeah.
Even with these patients, even just inserting a little finger to them, it's unbearable.
Yeah.
They can't withstand that.
Okay. So for me, the first time I heard about vaginismus, I was watching Sex Education, to be honest. So I was just on Netflix, binging on one of the shows, and one of the lead characters at vaginismus.
Yeah.
And I could see the struggle because she was talking to a psychologist, yes. So the show is centered through a psychologist. So they go with them in mental issues. So tell us, maybe, what do you think about vaginismus and mental health? Yes. What do you think? Is it
You know,
good for-
mental health is tied to our pelvis in terms of fight or flight. Maybe if you are in a situation where you feel scared, you're feeling anxious, you are triggering your flight or fight mode. So when for example it's fight, it's your body is tightening, your muscles tighten, and most especially your pelvis. You find that you hold your legs close together, and you try to to hold yourself like that, and through that your pelvic floor muscles get used to that tightness, and that can impact our pelvic floor muscles. They can change how the pelvic floor muscles work over time. Because if you're ever in situations where you're anxious or you're just ever having anxiety, and sometimes it even becomes part of you. You don't even notice that you have clenched your fist or you have crossed your legs. Becomes so part of you that
in your head you activate those muscles.
Yes.
So you have increased tone and your muscles are always guarding. So yeah, when talking about this condition, I would want to give that vaginismus is caused by both physical and psychological lesions. Yes. So the ones we've tackled are psychological issues, which include fear and anxiety. It comes from negative beliefs of sex. Yes. So like how our teachers used to, they really scare us about sex. So yeah. Can you imagine, like, I don't know, this is a very social issue, at least they tell you should be a virgin until married, and then now you're married, and then on that night you're expected to be okay.
Yeah,
And,
exactly.
and to receive this, something that has always been negatively perceived, now all of a sudden is good.
Yeah.
And you're supposed to be comfortable. And
You're
to do
expected
it.
to be good at it.
They are good at it, yeah. So fear and anxiety from negative beliefs about sex, past trauma, or cultural conditionings. Another cause could be a previous painful experience. Yes. So if somebody really had an instance of a painful intercourse, in other words, was raped, or has undergone a medical procedure, it could lead to subconscious muscle guarding.
And one thing with our muscles never forget. They never forget that trauma. Your mind you might suppress their memory, but your body never forgets. Yeah.
So another thing that could be psychological is lack of sexual education. Yes, you agree? You so like for me now we're being separated, boys are taught this, girls are taught this. And no one really talks about sex as being a good thing. So it's just sex is bad, you should not do it. So we grow up with misconceptions about the vagina, about sex, even about arousal.
Yeah.
Like, because you think it's wrong. So when you have it, you can have fear and increased tension. Yeah, so that could be a cause of vaginismus. That, rather than those psychological causes, we have the physical causes. Yes, which is if you have an underlying medical condition. So, for example, if you have like an infection, you have an endometriosis, and you have hormonal imbalances, it can exacerbate the issues.
Or sometimes if you are undergone genital female mutilation, it can affect the TGM, yes, down there. Or if you have had probably other like pelvic organ prolapse. So maybe that pain you used to experience or chronic pelvic pain. It has been so chronic, it has been there for a long time that your muscles have gotten used to that.
Yeah, so you already have like physical changes. Yeah. So there are things that a pelvic health specialist can point out for you. Yeah.
Yes.
And that's why you should go for an assessment.
Yes.
We should encourage the public to just go for a consultation, just to like visit a pelvic health, see what's going on with your body. So when you come from your gyna, so ask them whether you can talk to a pelvic health, or if they know any pelvic health specialist you can defy you too. Because sometimes, doctors don't have that time to take you through. But when you come to a Physio, you spend what? An hour also with the patient, and maybe we can be able to talk about these issues.
And actually, most of the pelvic health specialists are all women. So feel free to talk about your issues. They understand, they relate.
Yeah.
There's not a male pelvic floor PT actually.
So far.
It's
Let's just say so far.
so far across the world.
They're not saying men cannot treat pelvic health. It is saying that we have females more, yeah,
In this field.
yeah.
Because it's more an intimate thing. So
And I think I would also feel more comfortable talking to a woman as a man. I don't think a man will understand when I tell him like.
And maybe if your gyna is a man, maybe you can just walk into a pelvic floor PT's clinic. You just set up an appointment and talk to them.
Yeah. So yeah, we need to say that there is direct access to our physiotherapists, and you want to talk to them. So tell me, what do you do with patients? So for example, if I come to you with an issue of vaginismus, so what should I expect my session to be like? What are we going to talk about? And what treatments are you going to take me through?
So maybe during the assessment, there's a part where we take the history. We try to understand how it came about. So there are questions such as, do you have difficulty with penetration? Do you have pain with even initial penetration? Or do you just find yourself always avoiding it? Pain maybe with putting on your tampons or gynecological exams. And sometimes maybe intercourse can be possible, but is it always like painful? And then is it something that you've never ever been penetrated before, or it developed later, so that you can know if it's like a primary vaginismus or it's secondary to something else. Okay. And then we try and look at the triggers. What triggers you? Is it just the tampons, pelvic exams? Is it sex? The whole idea of even sex. We also try to look at the psychological history, like do you have any past trauma, any abuse, any anxiety, any relationship issues, probably, that have even affected your pelvic area. Or even, have you had any surgeries or given birth recently?
So all this is part of the assessment and history taking.
Yes.
Okay.
And then after that, we the first thing in treatment, we try to do education and desensitization. We try to teach the patient on what is going on their body and how the pelvic floor muscles are involved, and also the role on the brain-body connection, that it is very crucial. Education helps to reframe negative beliefs about pain and sex, reducing fear and anxiety associated with the penetration. Yes. And then after that, we move more into the manual therapy and the internal work. But first of all, when you see a patient on the first session, trust me, they won't tell you everything.
Sure.
Because they also don't know you. They're trying to gain trust with you. So it's going to be very difficult to do everything on the first day.
Yeah.
So on the first day, you normally want to focus on relaxation.
Okay.
You teach them on how to relax their body, how to be mindful of their body, to do more of this includes more of diaphragmatic breathing, progressive muscle relaxation. You're trying to teach them how to relax the pelvic floor muscles in different positions. And this can help to reduce the tension and increase comfort. Okay? So this is among the first things we do. Right? And probably also observation. We try to observe how the external muscles are of their private area. That is if the patient will be comfortable to undress, because some may not be on the first session. Just try to observe, and you can notice maybe one side is more tight, or maybe one side looks, there is no symmetry probably. Yes. But on other now visits, you can move on to maybe you can touch. And if they're okay, you can do an internal exams. Oh, yes. Okay. That is if they are okay.
That is if they're okay. Yes. Consent. We must say consent is number one and very important. Nobody should touch you when you've not agreed to. Yes. Even your doctor, yes, this is a therapist. Nobody has the right to touch you and touch your body without and we even have formal consent forms. Yes, that you have to actually sign against your name. So other than being taught how to breathe, the diaphragmatic breathing and how to relax your mind, is still some work that you need to do with the physiotherapist. Okay, so when you come for another session, you can, and after you sign your consent and you've agreed. So you are saying you'll do some
relaxation manual relaxation techniques on the muscles.
that's totally manual therapy.
Yes, and the manual therapy. And then we'll when internal work, because obviously the patient cannot tolerate anything inside, we use vaginal dilators. Oh, and they are of different sizes. There is as small as our pinky, our small finger, even smaller than our pinky, and then there is as big as you can imagine. So of course, if depending on the toleration of the patient, if they can't tolerate anything at all, you start with the smallest completely. And then when you're trying to insert, you have to coordinate the breathing with the insertion. So you teach the patient how to breathe into their pelvic floor muscles, how to bulge out, how to relax. The patient must be so relaxed, because physiotherapy doesn't have to be painful.
Yeah,
At least it doesn't have to
just they should stop calling us physical touchers, because these are not meant to be
painful. True. So you just start with the smallest one, and of course you use lubrication, and you try to tell the patient to relax, take a deep breath, and then you try to insert, and then they breathe out, take a deep breath again, and you give them these dilators to go home with, so that we're practicing in the or just on their bed when they are alone. Yes, you can be doing it. So with the time, there will be a progression. So the work of the dilators is to help desensitize the vaginal muscles, so that to numb the pain, and the vaginal muscles to get used to something being around it. And this can improve the comfort with penetration over time. The process is slow and guided, ensuring that the patient feels in control throughout. And it should be consistent. If you have been given a letters to go home with, you should not do it today and then you forget it for 1 week, and you have to. It has to be consistent every single day so that you get results.
Yeah, yes. And that's something now patients don't get, that even when you're doing this general physiotherapy work, that's most of the time is when you're alone as a patient. Then most of the time, so what you do in your alone time, so that is going to help their rehabilitation. It's not the that 1 hour you spend with me. Because that 1 hour, we might do a lot, but if you don't do anything for the rest of the week, you get the conditioning, you forget. Yeah. So, and we need to promote this awareness where the patient is in control. You need to be an active participant in their treatment. Yes. And that's the only way you can have voice effectiveness.
And because it's two-way traffic. Yeah, I'll give my probably 70%. You do your 30%. If I only do my part and you don't do your part, it will take a long time for us to ever
reach the goal. Yeah, and you might even not get to it. But they do lose patients to follow up. Yes.
Yeah.
Even in other general musculoskeletal conditions. Okay, is there anything else?
There is a machine known as biofeedback, which can show which exact vaginal muscles or pelvic floor muscles are very tight and which ones are more relaxed and at which tone what is their resting tone. So the biofeedback technology can be used to help patients learn how to control and relax their pelvic floor muscles. And also we teach the patients on mindfulness techniques.
So you teach your patients even mindfulness techniques? Like what?
Like you teach them how to take deep breaths. Like there is box breathing where you breathe for 4 seconds, hold for 4 seconds, breathe out for 4 seconds, hold for 4 seconds. It helps to relax the body. So there's also a breathing where you breathe in for 4 seconds, you hold for 6 seconds, you breathe out for 8 seconds. It helps to relax the body.
So it's like, I feel like I'm doing yoga now. You have to sit still, breathe like you at the station. I'm so grateful that Physio can do these things. So imagine. And they are medically and medically not supported. Is that sister is a jabba at India? They are teaching you to do things that are not that don't have any proof or any evidence. Okay.
And then as usual we give exercises.
Do at school. Yeah,
And they are pelvic floor exercises. People call them Kegel exercises, but Kegel is just not holding and relax and releasing, holding and releasing. It's about so these exercises, they help the patient to learn how to relax the pelvic floor.
And Kegels, in Kegels are more of strengthening. So in fact, Kegels could be bad for you when you have vaginismus. So you're not supposed to be doing Kegels. So don't go on Google and start looking at what Kegels are and how to do them. So yeah, you should have a guided exercise program. So that's looking into more of relaxation. So what should they be thinking about when it?
So the exercises are more about stretching, more about making the pelvic floor muscles to be more mobile, to lengthen, because vaginismus tightening means the muscles are shortened, like they become short. So we try to lengthen there. So these are they are actually breathing exercises in different positions. Probably while doing a deep squat. When you squat, you are spreading your pelvic floor out. That's why when we squat in the toilet, the poop comes out easily because you open a pelvic floor, or you spread your legs on the bed and do the breathing in your pelvic floor muscles. Or it's basically different positions that involve opening up of the pelvic floor muscles. Yes.
Okay. So I feel like when you have an opportunity to treat some of these conditions, it's a privilege. Yeah. So what is your feeling about that? What do you think about you as a healthcare provider and even as a woman and being 25 as it sounds, like you get to be part of this experience. So what is your take and what would you tell our patients that they can feel comfortable approaching.
So that it is true, it's a privilege to treat a patient with vaginismus, because addressing vaginismus requires compassion, and it requires you to have like a deep, it's like being vulnerable. The patient is being vulnerable with you. This is like their private area. And you find some patients, the vaginismus has affected them to the extent that their marriages, they are separated with their partners. Their boyfriends have left them because of it. They're unable to get children. Maybe they are married, but they can't get children. So it has affected their life holistically. But when you get to treat them, it's like you have changed their life in a 360 way, and they really feel nice. I remember we had a patient from Uganda. She was actually I think she's 25 like me. And she used to come all the way just for treatment. And she was in a relationship, and she was finding it hard to maintain relationships because she can't do anything down there. But we got to treat her. We saw her for like, I think 10 or 15 sessions. And at the end of it, she broke down. She was so happy. And she even called saying, I've had sex for the first time in a long time. And and it is so beautiful. And I don't know, I don't even know how to thank you. And she was so deeply happy. And I think we even ended up getting married. So you get to touch people's lives and change it in a very beautiful way. That is just not like a far-fetched, like you're just a patient and I treat you and you go.
Yes. Wow. So this has been a very insightful conversation. Let's say so. And I'm very grateful for your time and your knowledge, and even your vulnerability. Just tell us how your schooling experience has been and how your treatment sessions are. We don't really get to hear the doctor or the professional side of story. Very, very honest, and you that when giving us examples of your patients and what you're able to do for them. And I feel like it's very rewarding. That's when you get to participate in someone's life. That's why we do what we do, yes. And yeah, we'll continue talking more about pelvic health issues and his hand. And I am glad to have you on the podcast. And next time we will invite you and can continue talking more about these issues.
Thank you so much for having me on board. This is actually my first time being on a podcast. Thank you for having me as your guest, and we can do more and more. We can collaborate more.
Okay. Thank you for listening. If you would wish to have more information on this, you can access it on our blog, which is linked on the description box. Thank you and see you next time.